It's my pleasure now to introduce Tom Heah. Tom has once again, just the credibility of the speakers we have is remarkable. He is a MSc in occupational therapy and has taught MBSR and MBCT and other mindfulness programs at Vancouver Coastal Health since 2006. He's a mentor for mindfulness teacher trainees at the UCLA Training and Mindfulness Facilitation Program and at the Center for Mindfulness Studies, so an obvious expert in his field. Tom is trained in many mindfulness facilitator disciplines and is currently a clinical faculty member at the University of British Columbia School of Occupational Science and Occupational Therapy. Now, he's going to talk to us a bit of an evolution from what Rosemina and William did before that about meeting loneliness and social isolation with mindfulness, and what a perfect time to learn more about this. I don't know about you, but during the pandemic, there were moments, many moments, where social isolation from my friends, from my, outside my immediate family, and so many others was such an acute part of the experience, and not in a good way. So this session is designed to help participants understand and meet loneliness and social isolation with more ease and compassion. There will be a few things covered: the relationship between loneliness, social isolation, and of course, health. And he'll talk to us about mindful awareness, and also how that mindful awareness can help us meet these complex thoughts, emotions, and feelings associated with both loneliness and isolation. Tom, welcome.
Thank you, Ken. Thanks for the warm welcome. And I just like to start by just acknowledging and thanking the organizers, Helen and Irene and all the folks at TIES, at Alberta Mind Biotech, and the Alberta Ministry of Health for sponsoring this conference and for inviting such a wide range of amazing speakers, and humbly myself. And I'd like to just start by just acknowledging the land that I am on. I live on the unceded Coast Salish lands of the Musqueam, Tsleil-Waututh, and Squamish First Nations in Vancouver in British Columbia. I'm gonna just start by sharing the first slide. And as Ken said, I'll be talking a little bit about how mindfulness can meet loneliness and social isolation, which is something that all of us have experienced in different ways this year. Perhaps some of us have been moving in with our families and not liking it as much, and not appreciating as much the connection, and other people have appreciated that connection. So different relationships to mindfulness. And even as Ken talked about of loneliness, I could feel my own sort of sensations, familiar sensations from the last year kind of welling up. I'm not sure if some of you have noticed that as well. So I'd like to just start by just guiding us through a brief meditation, just to check in with what is actually arising, because that's certainly arising for me now, even just that word loneliness. And so I'd like to invite you to just come to a comfortable posture, whether you're standing, sitting, or lying down, and having a soft and perhaps unfocused open gaze, or if you prefer to close your eyes, that's fine as well. And taking a few moments just to connect with whatever supporting surface that you're on. And if you're living in an apartment, perhaps just sensing the ground on which that supporting surface is actually on. And as Rosemina invited us earlier, just perhaps if you know the First Nations land or the Aboriginal land that wherever you're located is on, just connecting with that, bringing that to mind, connecting with this land that is connecting all of us on this call, and in fact to all of us throughout the world. Feeling that sense of connection, or if there's disconnection, just noticing that as well. The invitation is to bring awareness to whatever is arising right now. We can sense this through our bodies. And perhaps as we're sitting or standing here, we can become aware of the sensations of the breath, or perhaps aware of other experiences outside of us, sounds. If your eyes are open, and even if they're closed, you can see through the eyelids. So just connecting with this thing called the earth, both the elements inside the body and around it. And by extension, the other people on this call and other people that are also supported by this land, this ground that we're sitting, standing, lying down on. And so just letting go of this brief practice, and we'll continue with this presentation / experiential session. And Ken has already mentioned what I'll be covering over the next few minutes. So this topic is about mindfulness and loneliness, and I'd like to just redefine, or not redefine, because it's been studied in so many different texts, and I just want to sort of locate or situate where mindfulness actually came from. As Rosmina mentioned, it does come from East and Southeast Asia. The original term for mindfulness was sati, that has been translated into its various forms by some of the teachers that have brought mindfulness to the West, including Thich Nhat Hanh, who is a Buddhist peace activist and a Buddhist monk, who has defined mindfulness as simply being aware of what's inside and around you in the present moment. And when you think about it, that's a very, very powerful definition. It's not only what's arising in us, but what's around us. And I think this is an important thing to be aware of, that mindfulness is not just an individual practice. It's a way to connect both with ourselves and with others. It's not, as Rosmina so beautifully pointed out in her talk, that is not a spiritual bypass, nor is it a way to not do systemic changes or structural changes in institutions or wherever we are located, but it's one of many tools to help us with skillful action. So one of the more well-known definitions in the West, in sort of more secular mindfulness circles, is that mindfulness is the awareness that arises when you pay attention with intention, on purpose, in the present moment, and without judgment. And this is a tricky one, this without judgment, because it's not so much judgment, but it's kind of allowing judgment to be present if it is present, but not, of course, to excuse poor behavior. So what mindfulness is not a substitute for systemic change. It's not a way to empty the mind, nor to accept poor behavior, or to escape the world, or to have a spiritual bypass. It is a way for us to live slightly, perhaps more fuller lives. Dr. Kaiken referred to flourishing as one of the other ends of mindfulness practice. We are so used to using mindfulness as a way to work with different health and medical health symptoms. And perhaps we've missed the opportunity to also use mindfulness to lead to a more flourishing life. And so mindfulness practice is really a way to be aware of our entire context, both positive and negative, and everything in between, neutral. So in the last year and a bit, as we all know, social isolation has been a big factor in many people's lives. And I just like to start by defining these two terms, social isolation and loneliness. And loneliness is really more of a subjective emotion that arises when there's a difference between our desired and actual quantity of social interactions, whereas social isolation is having few or infrequent human interactions. And social isolation has really been shown to be a strong risk factor for poor mental and physical health, leading to increases in depression and anxiety, leading to disturbances in sleep, increases in stress, and frailty in older adults. It has also been shown to lead to increases in mortality and associated with poor treatment responses and cognitive decline, as well as poor cognitive performance. It seems to peak in adolescents and in older people, and this has been an issue before the pandemic. So in this slide, we see that during the last year, social isolation and loneliness certainly has increased. If you look at the left part of the slide, what Angus Reid classified as so-called the desolate were those people who felt lonely and were socially isolated. And there was about 39% of Canadians fell in either the desolate category or felt lonely but were not feeling isolated. And even the number of people who felt so-called cherished, who were not lonely and not isolated, fell from 22% in 2019 to 12% in 2020. Study by Emily Jenkins and others last year found that the pandemic has disproportionately affected those who experience health, social, and other structural inequities. So if you were BIPOC, female, LGBTQ2+, have low income, have a disability, have a pre-existing mental health or physical health condition, you're more likely to feel lonely, possibly depressed, panicked, and hopeless, less content, and had poorer coping strategies. You were also less likely to have a supportive employer and were more likely to lose a job. And so these authors call for more equity-oriented public health and policy responses to protecting those who were most at risk and were most affected. So here, I kind of categorized some of the research on loneliness, meeting loneliness, evidence-based interventions into sort of environmental approaches, increasing social support and opportunities for social interactions, as well as structural change, so things like racism is sort of could be an environmental factor. Some sort of occupational things such as improving social skills or getting a new hobby, especially for younger folks like adolescents. For adults, the evidence seems to show that an approach that targets one's cognition through cognitive behavioral therapy, through mindfulness, and through other psychological therapies seem to show the most promise. But the evidence base, the effect sizes are kind of a little bit all over the place, and the quality of evidence is fairly low. So there's a lot more work to be done in this area. This is a unpublished kind of a middle of the night sketch that I put together to try and explore what conditions kind of lead to and maintain loneliness based on a paper by Cacioppo and Hawley in 2010. And so in this model, feeling isolated triggers this hypervigilance for social threats. So as social beings, we are meant to connect. We are meant to, and loneliness is an emotion that helps us to connect because we are social beings. And in this model, loneliness is a process of maladaptive social cognitions, which thinks of other beings as a threat. So having this hypervigilance triggers a whole host of stress reactions, which are pretty much uncomfortable in the body and lead to uncomfortable feelings and thoughts that then act on our negative social expectations that people around us are a threat. And perhaps some of you might have experienced this during the pandemic. I know I did. When I went into a store, I had this perception that other people actually were a threat, and perhaps they might have been. So this leads people to then behave in ways to confirm their bias, and with these reactions leading to more social isolation or maintaining one's social isolation. And of course, triggers such as we've had over the last year as the pandemic, racism, unjust work or societal structures, health and job losses, mental health issues, and so on. So because this is a mindfulness conference, I thought I'd just focus on one of these evidence-based interventions. There was a paper by Heah and others in 2021 and these were the first people who published a systematic review and meta-analysis. And a meta-analysis is just a conglomeration of strong evidence-based papers to look at how mindfulness interventions could possibly work for targeting loneliness. And it seems that mindfulness helps with improving communication as well as relationship satisfaction and increasing compassion and acceptance. And one of the studies that kind of drew my attention was this one by Lindsay and others in 2019, which showed that mindfulness could actually, with acceptance, could help decrease loneliness by 23% and increase the social interactions of those who practice this by 1 person a day. So it does hold some promise. This is one of the first studies to sort of what we call dismantle the process of mindfulness meditation into bare attention and attention with acceptance. And so without further ado, I'd like to guide us or invite you to join me in a practice for a few minutes. And coming to a comfortable posture, either in your chair or standing. A posture that's upright and alert. And the eyes can be open with a soft and unfocused gaze, or alternatively, you could close the eyes. And feeling the feet pressing into the floor, the body pressing into the chair, feeling the weight, feeling the body grounded here, perhaps hearing sounds as they arise and disappear, allowing whatever emotions or thoughts or feelings that are present to be here. Turning the attention to sounds, to hearing. Just allowing the sound to come and go. Some may be pleasant, others unpleasant, or others somewhere in between, pleasant and unpleasant, neutral. And now I invite you to shift the attention to the sensations of the breath, wherever the breath may be vividly felt for you. Breath can be felt at the nostrils for some of us. You can feel the air coming in and out, perhaps different temperatures of air. It's like tickling at the nostrils. Or you might feel the breath more vividly at the chest, rising and falling. Or the belly, expanding and contracting with the in and out breaths. So just resting your attention at one of these three areas if that is comfortable for you. Or if you prefer, resting your attention on sounds, on hearing. So for the next couple of minutes, choosing either the breath to rest your attention on or on sounds, listening to sounds coming and going. And we're not looking to hear anything in particular with hearing, nor are we expecting or trying to control the breath to make us feel anything in particular when we're attending to the breath. Simply allowing the body to breathe on its own. And now I'd like to invite you to shift the attention to the entire body, sitting, standing, or lying here. Perhaps feeling the sensations at the contacts between the feet and the floor, or the body and your chair, or couch, or bed, or other supporting surface. Feeling a sense of support from the ground. Noticing the sensations throughout the entire body. Easeful sensations, less easeful sensations, areas of bracing or tensing, and other areas of calm, softness, and ease. And for the next few moments, choosing either hearing or receiving sounds as what we call the anchor for your attention to come back to, or the breath at one of those three places at the nostrils, chest, or belly. Or you can use the entire body as the home base or the anchor for your attention. And as we attend to one of these three areas, perhaps we might notice some other experiences arising. Perhaps some emotions, perhaps loneliness, other emotions. And if loneliness is arising, or sense of loneliness that's familiar, sense of sensations in the body, And the invitation is to bring our kind attention to the sensations of loneliness, perhaps naming it as such. Loneliness is here, or the emotion of loneliness or sadness, or perhaps there's irritation arising, or other emotions, frustration. Allowing the attention to rest here for a moment or two. And if you wish, bringing the attention back to either the breath or sounds or to sensations in the body. And then bringing the attention back to the sensations or the emotion that's arising. And as we do so, resting attention on the emotions, noticing what else is arising, whether there's a sense of wanting this to go away or wanting this to stay. And then acknowledging that as our new experience. We can then become aware of that experience of pushing away or hanging on to. And then perhaps bringing the attention back to hearing and sounds, or back to the breath, feeling the sensations of air coming in and out of the body, or back to the sensations of the body. And perhaps if you wish, going back to the emotion that's arising of loneliness, and seeing if we can bring a sense of kindness to this feeling, to whatever is arising. And we're bringing kindness not to make anything happen, nor even to feel kind. We're simply intending to bring kindness to whatever is arising, or the possibility of bringing kindness to whatever is arising in this moment. Allowing the emotion to be there. Allowing the body to be just as it is, holding this emotion with kindness. Bringing a sense of allowance to whatever is here. And as we do this practice, we might also take a moment to reflect on who else in our life might be lonely. Who else in our life might feel isolated. And if no one comes to mind, perhaps just imagining or visualizing a community of people that might feel isolated or lonely. Knowing that we're not alone in our aloneness. And then beginning to wish this person, this community, some compassion. May your loneliness be alleviated. May your loneliness be alleviated. May you feel ease despite the conditions of your life. wishing compassion and kindness to others who are perhaps feeling like we are, or perhaps feeling like we aren't. May you find peace and kindness in the midst of your loneliness. And then perhaps now expanding this wish for kindness and compassion wider, perhaps to all the members on this call. May all beings everywhere be free from suffering. May all beings everywhere be free from loneliness, or have our loneliness eased and alleviated. And may all beings everywhere be happy. And perhaps for a moment or two, sensing the interconnection between us. And if that's not what's being sensed, then just noticing that as well, having compassion and kindness for the sensation of no connection. Bringing kindness and compassion to the possibility of connection. And letting go of this practice, bringing the attention to hearing or sounds, or to the sensations of breathing, or to the sense or sensations of the body. And opening your eyes if they were closed, and widening your gaze if they were open. And I'm just looking at the time, and I think I'm out of time, so I'll just quickly go to this last slide. So thank you for joining me, those of you who did with the practice, and I'm sorry I went a bit over time. So just a quick summary. The mindfulness I put in red is not a way to accept injustice or bypassing needed systemic change, nor a spiritual bypass. It's not an individual practice, but it is a way for us to connect both with ourselves and with our society. And it's an awareness of both inside and outside. And I think perhaps that's what I really want to leave you with, because Willem and Rosemina discussed many of these other aspects of how perhaps mindfulness might function in terms of its mechanics. But the two main points are the sense of connection and kindness and compassion, both for ourselves and for others, whether it's with loneliness or other difficult emotions. So I'd like to thank you for your kind attention.
Thank you very much, Tom. I took away a lot from what you said, but the phrase I keep coming back to myself is the possibility of bringing kindness into whatever is arising. What a beautiful way to think about where we've been, where we're going, and how we can show compassion to ourselves and the others around us. We have gone a little over time. Now, it's not the end of the world, but it does truncate our question period. What I'd ask you to do is, I know you're going to be staying on to listen to Andrea and others. If people have questions, they can put them into the chat, and Tom can explore those with you that way. I know that there's probably things about seniors, as one of the groups and collection of individuals that must have seen isolation in really, really difficult ways over time, and even marginalized groups and newcomers and others. So I think this is a powerful set of tools and a practice that you've shown us. Thank you very much.